In this video, we are going to talk about one of my absolute favorite treatments that you can do to make sure that a kiddo has equal trunk mobility in the side-to-side plane. Stay tuned. Hi, I'm Dr. Lauren Baker, a pediatric physical therapist, and on this channel, we help proactive parents learn how to help their babies move better. Think of me as your pediatric physical therapy bestie, here to help you learn how to help your babies move with confidence and ease. There are two ways typically to increase range of motion. So say it's really easy for me to go to my right side, but it's really hard for me to go to my left side. My right side is going to be my easy side, and it's also going to be the side that has the tight muscle. When I go to contract my left side, my right side has to be able to let go and elongate, and if it is tight, it is not going to be able to release. So then I'm not going to be able to go to my left side. In traditional stretching, we are trying to pull structures so that they become longer and then we gain the range of motion. So in this example, we would want to try to push myself over to the left side to stretch that right side muscle so that it is able to release. Sometimes in stretching that can create micro damage, and some of those fibers microscopically become unhappy because we are pulling them against a resistance, and that is not their preferred place to be. With total motion release, we have the same goal, which is to increase range of motion, which is to be able to go to the left side and the right side equally. With babies, total motion release can be really helpful because it's a much gentler way to increase range of motion. So if my right side is tight and it's easy to go into side bend, I'm actually going to utilize that side bend to my advantage, hold that position, and then neurologically those muscles are going to relax and then increase range of motion to the left without creating some of that microscopic cellular damage by pulling against the resistance. So total motion release is a different type of treatment with a different philosophy that has the same end goal that stretching does. Something that's unique to total motion release is that you only do the one side. So you do not do it both sides like you would with traditional stretching. You would only do the easy side. Now, it is recommended that a child is evaluated by a provider who has been trained in total motion release before doing these activities. Please note that if your child has not been evaluated by a pediatric physical therapist or physiotherapist, that I do recommend Googling total motion release providers and having them evaluated before going forward with any of the techniques explained in this video. If you do have questions, make sure to check the pinned comment because there will be a link and a way for you to schedule online with me where we can answer more questions about total motion release and I can connect you with a provider near you. Now, if you have been evaluated, maybe you're one of my kiddos and you need this video to be reminded of how to do the exercise, feel free to learn more and utilize this information to make your home exercise program more efficient. I'm going to check side bend. So I'm going to bring her pelvis over to this way. Left side bend is, it's named for the direction where you have the C, the smaller part of the C. And then if I bring hips to the right, that's actually pretty good too. I'm going to show you here. You can see that I'm bringing my hands underneath her bottom in a C shape. That's how my hands look in that C shape, and my thumbs are together. I'm tucking her bottom up towards her head. So that is called a posterior pelvic tilt. So her body is becoming more of a curved shape. So I'm tucking her bottom up and then I'm going to slide it over as if I'm bringing her left knee to her left elbow, and I'm just going to the level of her resistance. So if she kicks me out, I'm not going to force her trunk past that. I'm just seeing what range she has available. You can see when I bring her right knee to her right elbow that her trunk bends so much more than if I bring her left knee to her left elbow. There's more space there. It doesn't come as close. Now again, all of this motion is happening at her pelvis and at her spine, not actually at her hip joint. So while her knee is going towards her elbow, that is because her body is curving, not because I'm putting any pressure on the hips. So again, you can see that I scoot that right knee over towards that right elbow, and you can see that her left side elongates. So it's really flexible. It moves quite easily on the floor. She's not giving me much resistance there at all. If I were to do the other side, she wouldn't go as far. And that is the assessment portion of how to determine if your child has a trunk restriction side to side. Next, we'll go into a way to treat using the total motion release method. So now that you know what total motion release is and how to do it, we are going to go to the easy side. Again, I have both of my hands on her pelvis. I've tilted it up and I'm bringing her right side of her trunk into a backwards C shape. So you can see the right side of her body is curved and the left side of her body is elongated. I'm going to hold this position for approximately 2 minutes. If the child kicks me out of this position, I'm going to let her kick me out. I'm not going to hold it against any child-produced resistance. I gave her something to hold that's easy to hold. A lot of times babies will struggle laying on their back, so you want to give them something that they can be entertained with, anything that they are comfortable putting in their mouth can be really helpful because it can have a calming effect on the baby. And then she kind of kicked me out there, but I wasn't quite at 2 minutes, so I repositioned and brought her back into end range. I'm not going to push against any resistance. So I'm just gathering up that available slack and I'm holding that position. And the process behind this is that you are shortening the tight side so that it neurologically relaxes and then allows increased range of motion when you go to retest the motion at the end. So we are just continuing to hold that position. You can see that she is engaged. She can grab her feet from this position as long as the child doesn't go into any rotation and they stay just in that side bend position. That is what you want here. You can give them like little movements there, and you can also sing songs, give funny faces, give funny noises, anything like that to distract the child while you're holding them in that position. So again, you can see that I am holding her here, and we will fast forward to the end of the 2 minutes. So now I'm going to retest the motion side to side, and I'm going to go to the side that was previously restricted and just see if it moves easier. And you can see that that knee goes much closer to that elbow. She's loosened up quite a bit, which is really exciting. I'm not going to push it. You can also do the hold for longer than 2 minutes, closer to 5 minutes. It really just depends on the baby's tolerance, but we want the sides to be equal. So if you don't feel like it's equal, you can then go back and redo that hold. After you do the hold though, make sure that you follow it up with some vestibular motions. So you can see here that I'm giving her bounces. If you have a baby, you can give them bounces. I'm just holding her under her armpits and then my hand is underneath her bottom. I know you can't really see it. There we go. And then my hand is underneath the bottom and I'm just giving her gentle bounces for 30 seconds to a minute just to re-regulate that central nervous system and make sure that she is able to hold that new range of motion that we have achieved. Now, I did want to come in here and make sure that I was very clear that if going to the right side is the more restricted side, that in order to treat utilizing the TMR method, that you are going to treat the easy side or the left side. In this baby model, her easy side is the right side, but in general, it could be either side that is tight for a child. So if your child's easy side is their left side, it is going to look exactly like the one before, just the opposite. So if the easy side is the left side, again, you're going to tuck the pelvis up, go to that side, and then you're just going to hold it there for 2 to 5 minutes and then follow that up with 30 seconds of bouncing and retesting side to side. Again, you only do the one direction, which is easiest for the total motion release philosophy. You're going to the easy side, holding that side for 2 to 5 minutes, following it up with a vestibular input exercise or proprioceptive exercise, which would be that bouncing position for 30 seconds to a minute. And then you can work on a fundamental skill like rolling or crawling based on where your kiddo is at. And that's a wrap, friends. I'm so excited and proud of you that you took the time to get all the way to the end of this video. That shows me that you really, really are invested, making sure that your baby has absolutely everything they need in order to move well. I love utilizing strategic play positions to help parents connect more fully with their littles, as well as to help them be as strong and as mobile as possible. So thank you so much for spending time to learn more about how your baby moves. If you have any questions, make sure you check that pinned comment, because you can schedule a one-on-one online consultation with me and we can just chat about all the things in this season, including mobility and other exercises. This is an area where it definitely helps knowing a little bit more about where a little is struggling and a little bit more about them. And then I can point you to resources, including pediatric physical or physiotherapists in your area, exercises you can safely do on your own at home, and other things that can be really helpful for this movement season. If you are like me and you're obsessed with learning more about these different techniques, make sure you check this video out. It is going to go through a different type of TMR positional release where we look at a different plane of motion, including rotation of the upper trunk and the lower trunk. And that is so vital for kiddos, especially those working on rolling and crawling.